with that, I'm going to turn it over to Caitlin from MedHerrent and Sama to talk to us about MedHerrent. Thank you.
Sure, absolutely. Thanks for being here, guys. My name's Caitlin Manley. I'm the Director of Agency Services for Terrapin Pharmacy. We're a small behavioral health-focused pharmacy in Annapolis, Maryland. What you see behind me is a device called MedHerrent. It's a remote med management and dispensing system. It mounts onto the wall of someone's home, allows them to independently manage their medications, and provides a level of oversight from caregivers. Everything from, it's got a video conferencing feature to pings if someone neglects to take their medications or if they miss a dose time. What I'd like to do is actually show a quick video about it, if that works, instead of listening to me rambling. And then Sama is our beta tester, alpha tester, OG MedHerrent user. She's got a lot of medical technology experience and has a device in her home that she uses every day. She's going to talk a little bit about what that experience is, and then we can do questions and answers. Okay, so can everybody hear and see this before I get too far into it? Are we good?
Yeah, you're good. Yep, we can hear it.
Okay, cool. Awesome.
Machine approximately about 3 months. Been real convenient. It reminds me when I need to take my medication when I can't remind myself. The packages are readable. I don't have to fumble around wondering if I'm taking AM or PM medication. The pharmacy already separates it. It's been a gold mine to me. I would recommend it to the world.
Absolutely. We have so many benefits of being able to even look at adherence rates. And, you know, nobody is forcing people to take medications. They have to choose to adhere to medications. So that's regardless of what you're doing. But, you know, having the ability to run reports, that everything that is tied in with the system. We have gone to specialists and said, oh, here's the report of somebody's like medication and what they're taking, and you have specialists looking at you like, this is amazing. We're turning in graphs of, you know, blood sugars, things that really can change social determinants, you know, in people's health. So you can actually get better care because you're able to also use some of this. You're able to say, hey, what's going on with someone? Let me take a look at where they are with their medications. If they've been taking them, have they been taking them later? This is a huge difference too in how you do an intervention, or when you're able to catch something is quite not right with somebody, or, you know, they're decompensating in some way. So there's alerts set up in the system. You can be alerted without relying on, hey, is somebody always going to do this? It's really automated and being able to tell you so much data. And we've empowered a lot of clients in that process. This is something where people have been in state hospitals, in hospitals. They've had people control or have an input on so many aspects of their life. And this is one area you can really empower them again, you know? And that's so important. Not only if it's for your clients and you believe in what you do, but for, if that was your family, you would want that, you know? So having the MedHerrent devices definitely gave the staff and the residential counselors' ability to spend more time with the clients for rehab services, and meds are important. So it also gave us a quality control aspect over the meds, and it improved, med errors. So we didn't lose, we improved quality when it came to reducing med errors and accuracy of medications and not having med omissions with getting the device. And then in addition to that, it gave the staff more time to spend with clients and with rehab services, because they were not having to do things like monthly pill counts or weekly reconciliation. So in the beginning, when we started getting the machines and we started moving towards MedHerent and using Terrapin, prior to that, in a quarter, we had about 44 med errors. We dropped to 4. And those med errors that were at 4 were due to still people and not MedHerent devices. And some of those are preventable, so maybe not preventable, because we, of course, monitor medication. We don't administer medication.
So that is the general gist of MedHerent. What you saw were folks from a residential program for adults with serious and persistent mental illness talking about how they use the device, as well as obviously a couple of consumers who are using it. Does anyone have any upfront questions before we let Sama kind of jump in about her experience?
Yeah, if you have questions, attendees, remember you're on mute and you can throw those in the chat. Caitlin and Sama, I'll come back up on the screen if I see something come in there. And actually, I see a new message now. Looks like Carol has her hand up. Carol, if you have a question, please go ahead and throw it in the chat, and we'll get that question answered. But go ahead, Sama or Caitlin.
I'm taking over. Here we go. Oh, no, go ahead.
I'm seeing a question. Would this work in rural areas, areas with minimum Wi-Fi? What are the operating requirements? It's a super good question. So yeah, we put this in a lot of group homes where they don't have Wi-Fi. We will install a hotspot that uses cellular data on the device. It doesn't take a ton of bandwidth, so it usually works pretty well. As far as operating requirements, it's actually an Android tablet that's embedded in it. That's what the screen is. So all of the software is on there. The tablet itself in the device does not store any PHI. It pushes up to our cloud system. And then there's a website that caretakers, users, et cetera, can log into remotely to see what the activity is on the device or manage it without physically being in front of it. Any other questions? Sama, you wanna? I don't see any other questions, Sama. If you wanna kind of talk about your.
I'm in. Okay. So first of all, I'm a fanatic of the MedHerent solution, and let me tell you why. I am both a patient and a provider. So I am a retired state rehabilitation technologist, and I'm also a retired IT professional. I had to retire medically early. I am a patient navigator now. I have opened up a business for myself doing benefits counseling, patient navigation, and connecting people with assistive technology that's going to suit them. I have multiple rare disabilities myself, and the problems that brings upon me are tremendous. In fact, most people with my condition don't get as far in their careers as I have and continue to go. So I continue to work even though I had to retire. I went into business for myself, and self-employment for people with disabilities is a big deal. So what does that have to do with this technology, the MedHerent machine? Is that I take somewhere between 23 and 26 oral medications scheduled in a day to stay alive and stay well so that I can work and live independently, or as independently as possible. And that's not including topicals, injections as needed, or PRN meds. And for all of that, that's a big number. And compliance, independent compliance, not an option. I can learn any language you want. I can't do math. It takes me a very long time to manage my medications. My aide, I have the platinum standard home health aide. She's a retired pediatric OR nurse from South Korea. So even with my aide, I struggle to stay in compliance with my medications. And if you have ever made a massive medication error with just the tiniest glitch in your process, you know that that's a bad day, and probably a bad several days while you recover from it. It's just not an option. And to sort through all of my medications without it, it's a bad day. I remain in the workforce because MedHerent, and specifically Terrapin Pharmacy staff, have got me. I I can't have a med tech coming in 3 days a week and make sure that I can hear them 3 floors down from my townhome to open the door, because I'm also unilaterally deaf. So I have to schedule all of that out. I also have to keep a flexible schedule because having a rare disorder means that my providers are not available. Just, to say, oh, well, Tuesday doesn't work for me. No, it's, hey, do you want this appointment in 6 months, or do you want this appointment 3 months out from that? Those are your 2 options. And it's a lot of times you have to travel out of state for care, and all of those things make medication compliance intolerable. It's the nicest word that I have for it. And I'm a New Yorker, so it's a stressful thing. But because I've had Terrapin and the MedHerent machine behind me, I don't suffer the way I did for years. I would be in tears counting out pills and worrying about, heaven forbid, I should drop one. I've got cats. What if a kid, someone brings their child to my home? It's a nightmare. And so I have this technology that can keep up with me because it's got a schedule that I set with my pharmacy and my doctor that I can control. I know that I'm going to get the right meds at the right time. I know that there aren't going to be any medication conflicts. I know, because the pharmacy is there for me, I know when I'm going to need a refill of the machine. They watch it. I know when I need a new prescription from my doctor because the pharmacy watches it. The human element behind the assistive technology is the part of the AT Act that, the AT Act has 2 parts for assistance, right? One is the device, and 2 is the training support. And Terrapin Pharmacy has just absolutely nailed it. I'm not the kind of person to blow smoke where smoke shouldn't go. I wouldn't say it if I didn't. I mean, I literally have to trust my life to my pharmacy. I have to ask myself, with any provider, can I trust you and can you help me? And the answer to both of those things has always been unequivocally yes. I have the same small group of pharmacy staff that I work with every time. So I have that human element of consistency. I have support for any updates that come through. And the device itself has been through several iterations at this point. Every upgrade is very carefully contrived. Accessibility is considered directly according to the people they're currently serving, to make sure that the people they're serving are getting the priority because accessibility is part of their development process. It's not an afterthought.
So,
They're
Sama,
doing everything
sorry.
right.
I love hearing you talk about this. Can I jump in and sort of talk a little bit about what exactly that looks like in the real world? So I mentioned that the devices mount in someone's home, either in their bedroom or somewhere else in their house. Our pharmacy staff, so we dispense medication in unit dose bags. You saw a couple of those in the videos. And then our pharmacy staff either comes in and loads the medication in the devices, or with some agencies, we've trained caretakers or direct care staff to load the devices themselves. I'm seeing a question, is there only one version of the device for quantity and sizes? And yes, right now this is the Gen 2 device. It's designed to be one device per patient. We can fit, if somebody has 3 or fewer dose times in there, we can fit a month's worth of meds in. If they take meds 4 to 6 times a day, we can fit in 16 days worth, so roughly 2 weeks. We dispense all of our medications on the same day each month. And then if there are changes made mid-cycle or mid-month, we'll come out and manually make those changes by adding a new medication, by pulling old meds out and putting new ones in, whatever the change is. So that's sort of the paradigm of the service that comes along with the MedHerent. I'm also seeing a question, what regions could we be able to come in and fill the devices? Right now we're licensed in, and I think my boss is on this call, but not as a panelist. We're licensed in, I believe, 13 or 14 states. We are based out of Annapolis, but we're pretty flexible in terms of the East Coast. If there were an organization that wanted a reasonable amount of volume for the patients in other areas, we definitely would be open to exploring that. I know we've spoken with groups far outside of the East Coast and are absolutely willing to look at expansion and stuff.
Okay, Caitlin, is there someone else that I should promote to a panelist, or?
Yardley Green, if he is on here.
Yep. Hold on one second.
Not,
Yardley, you're coming up as a panelist. If you want to talk, you can. So I assume, question from me, Caitlin or Yardley, I assume if you are not licensed in a specific state, can you still package the medications and ship the medications in the packaging, and then train someone locally to fill that machine, or can you dispense drugs across state lines?
Good question. So you can get non-resident pharmacy license depending on the state. It's a relatively short process to do that, and you can do exactly that.
Okay.
But the way that we've approached the market, because there's not particularly good reimbursement directly for this service at this point, is that we become the sole source pharmacy provider for large agencies and make a significant number of these devices available at no cost to the patient based on the volume. And then when you're looking at doing it in the more independent environment, you would have to figure out how to support that. But yeah, I mean, as Caitlin said, we are looking to aggressively expand, really believe that the more devices and more patients we serve, the more easy it will be to make the case that this should be a compensable item under Medicaid and Medicare. And we're starting to see that with the remote monitoring reimbursements. So we're very optimistic. We just acquired a pharmacy in Pennsylvania. We'll be expanding into PA with this service. And as Caitlin mentioned, we are licensed in 15 other states.
So we're flexible. We're as flexible as possible.
I assume that you guys are also billing the device, the cost of the device is sometimes paid through assistive technology if the state waiver program has that. Is that the case, or is it always just wrapped into the cost of the medication?
We are actually in the middle of a process with Maryland's Medicaid waiver program to get, establish a sustainable reimbursement stream. However, to date, we're like the vast majority of these devices are just wrapped into the sole source pharmacy agreement based on the volume of the
agency or whatever.
So
Right.
I'd like to speak to that point, if I may. From both the benefits counselor perspective and as a Medicaid waiver recipient, one of my most recent rejections, so my annual care plan was rejected because with my rare condition, my nurse who did my eval doesn't really understand what my needs are because I don't look sick. I don't look like there's anything that I really need to the untrained eye. And so part of the appeal that I have to write to get my plan through is I have to personally take time and explain to them why I need the assistance from my aide or my med tech, why I need an hour and a half a week of help to manage my medications. So even with, which works out to like what, 20, 30 minutes a day, but even with MedHerent, I've still got many other, topicals, like I said, injections, different meds and procedures and things I have to do that I need help with. And just trying to get that through, even without an assistive device, is a nightmare. And the assistive device, I don't know what I would do without it because MedHerent at least takes care of 23 of the bunch of meds. I can't imagine trying to get that through, and this would be a much more difficult process for me if I didn't have the assistance. But it needs to get covered through AT. It just absolutely needs to. And I look forward to that day because I feel like it's one of the best kept secrets of the AT medical assistive world.
Thanks, Sama. So there's a question from Nick at THS. So if an individual is determined to keep their current pharmacy for the dosing pouches, would other pouches work in this device if compensation for the device and the service fee could be worked out? I think I understand the question, but let me rephrase it. So you're asking, is it possible to use other pharmacies' packaging in our MedHerent devices? There's two answers to that. The short answer is yes. The machine's not packaging. It's not a single type of multi-dose packaging that works in the device. However, from a data integration perspective, it's really going to be difficult to make it work the way that it currently works with alternative pharmacies because of the way that our data integration is set up. It's not a cheap thing for pharmacies to do. So that's sort of been
basically the MedHerent software is linked to our pharmacy software and is driven by when we process prescriptions. That's how it knows like when to dispense medications and that kind of thing. So doing that integration into another system is probably, as Yardley said, more expensive than any other pharmacy would really be interested in pursuing.
Right. That being said, we've designed it to be plug and play at the best of our ability. But my experience and the reason we didn't go down the route of licensing this to other pharmacies is that they don't invest upfront for things that, only a few patients are going to be exposed to. Does that answer the question, Nick?
That was a good question. Thanks, Nick.
At this point in human history, I wouldn't want that. The pharmacy that serves it is the pharmacy that invented it. And again, with accessibility being where it is, with their attention to my physicians and my care, my refills, and then any technical issues that I have, they're on top of it because it's a small, well-managed ecosystem. And when you look at any kind of assistive technology, you always want to look at who are the people behind it who are supporting it, because you end up getting the runaround. Do I go to my rehab provider? Do I go to my physician? And just Terrapin Pharmacy has a method that gives me the person I need. I never have to escalate an issue because they just handle it. There's always a pathway through. There's always something they're monitoring for. There's a reason. There's data behind it. And I think Yardley's spot on. The way they manage their data has a significant impact. It's a value. That is the human element that replaces a certified med tech coming in 3 times a day just to hand me my own pills.
Good point, Sama. I actually have a question. In the video, it looked like there was a face on the screen in the device. Is that a feature where family or other people through an app or something can call in and observe and interact as the person's? Okay.
Yeah.
You got it.
That's exactly what that is. Yeah, it's got video conferencing feature. It goes through Amazon Chime, which is HIPAA compliant. And yeah, family members, caregivers could schedule a video conference. They could schedule to actually watch someone put meds in their mouth and make sure that they're swallowing them. They could loop in other providers like a therapist or a prescriber or something like that. And if there's any sort of emergency, it actually has the option to pop the camera on after a warning in case, so they could see what's going on in the background of the device.
We pushed this to the front of our development roadmap because of the pandemic. We wanted to be able to enable the deployment of remote service, provision using this video consultation platform. So it's pretty exciting to be able to do that. And yes, I'm glad you picked up on that. So all of the above, patients, family members, and providers can access that. And it's a web-based platform rather than an app-based platform, just from a technology management perspective. It's easier to deploy it that way.
Sounds like you guys have put a lot of thought into that.
Some of us who need that kind of technology don't have that family support. That's another thing that needs to be known, because I'll just tell you, I got sick for several days, too sick to get out of bed and take my medications. And the first person I heard from was a representative from Terrapin saying, hey, we've been monitoring and we noticed you haven't taken your meds. Is everything okay? And, it was just enough of a check-in to say, okay, I need to put some other solution in place and take care of myself, because that independence also comes from a lack of support for a lot of people. That's very valuable.
So if you don't mind, Sama, I'm going to go back to the early days when we first started doing this for you. And before we installed the machine, you told us, I get up at 6 a.m. every day and take my meds. And this sort of is an interesting segue into the usefulness of this data. After about a week, I called you and said, hey, what's going on? I'm noticing that you're not taking the meds at 6 a.m. And it was just that we needed to move the dose schedule back by a couple of hours to accommodate when you would be able to take the meds. And you went from about 50% adherent to close to 85 to 90% adherent, just because we were closely watching when you are actually able to take the meds. And that's the type of adjustment that makes a world of difference for people. The doctor's right for BID dosing, and it doesn't necessarily fit 8 a.m. and 8 p.m. doesn't necessarily fit people's lifestyles. So that type of just tiny schedule adjustment has made big differences for lots of people.
Yeah, that's actually probably one of the most surprising, tiny tweaks that really we see actual changes in people's use and their adherence and stuff. It's very neat.
Tammy just asked a question. What if a person is going to be away at med times? Is there a way to dispense early and track it? That's a great question, Tammy. There's a lot of flexibility with how you can access medications. It really depends on the setting that the patient or individual is in. Somebody who's living independently without anyone else living in their residence, we have very low thresholds for accessing your meds, meaning we won't even necessarily require a PIN number to identify the patient. And then we can also take off all restrictions for accessing the medications in or outside of their dosing window. So what that means is we have a way to enable you to get your meds out before your dose window and after, as long as you're authorized to do that. There are situations, however, where those times need to be restrictive, and you don't want patients to get meds outside of the dose window. And so we play well in both of those situations. We also have designed what we call our advanced dosing system to accommodate leaves of absence and actually to enable staff to automate the dispensing for people who aren't capable of interacting with a touchscreen interface. There's some folks that just don't have enough circulation in their fingers or have dexterity issues or cognitive issues that prevent them from being able to press the button on the screen. And what staff has done, what we've done with our advanced dosing system is enable for staff to set up times in the future where meds will be automatically dispensed. And that's one of the main reasons why we rolled out the video consultation, is so that at those times you can conduct a face-to-face to see that they've actually gotten their meds. Does that answer the question?
Great.
Yeah.
Great.
Carol, I saw that you had your hand up. If you do have a question, go ahead and throw it in the chat. Or if anyone else has any other questions, please feel free to throw it in the chat. Caitlin, I don't want to cut you guys short if you had something else you'd like to discuss.
Let me just jump in and talk about the future developments, and then Caitlin, feel free to add anything that I miss. A few of the things that we're working on for rollout in the next few months is pairing these devices with biometric monitoring devices, so that folks that are managing other somatic conditions can also pair, let's say, a scale if they have congestive heart failure, or a blood pressure cuff if they're managing high blood pressure, or a glucometer if they're managing diabetes. And that way that we can sort of be the medical hub and combine medication adherence data with biometric outcomes. So we're pretty excited about that also.
Awesome. Are you guys going to be doing the monitoring of those devices, of that data?
To the extent that it makes sense, instead of monitoring it, we'll be putting it in the hands of people who are really more responsible for the management of those conditions.
Okay.
So like with
they work with my doctor correctly on a regular basis, and I'm always informed. I am always in full control of my care, because they will liaise for all of the extra things, which, all of those little refills and what's appropriate, what are the outcomes, what's my compliance. They handle that so that I can talk with my physician about the core things that I need to talk about and just raise the bar.
Yeah, that's very cool.
I keep interrupting you, Caitlin. I'm sorry for doing that, but
I know, it's so rude. This is why I didn't want. No, I was kidding.
So Sama is our greatest advocate, and she gets special love from us. So I want to make it clear that, in most cases where we're serving clients, we're trying to plug this type of information into the appropriate care provider. So in like community behavioral health, that means putting it in the hands of the health home nurse, who's really managing the population health and making sure people are getting out to their specialists. Sama is a special case for us, and we do monitor her very, very carefully and cautiously and try to be, overly involved. But that's because she doesn't have the same type of support network that's wrapped around her the way that most of our clients do.
We really try to provide information to case managers, family member advocate, whatever, something like that, and give it so that they can go in. They're not relying on us to pull, data for a month. They can go in and look at any point at what you know, when someone's taken their medications or if they haven't or not. We're not trying to turn into case managers. We're trying to sort of facilitate all of that management for the person and for their support network with as much actionable information as possible. One of the things that has been shown is that prescribers and patients and caregivers are not great at assessing things like medication adherence. You know, if I go to my doctor and they ask me if I'm taking my meds, I say yes. But, you know, that's not necessarily the case 100% of the time. So trying to give that sort of information to the folks who can use it to really make changes in the person's lives is kind of where we see ourselves fitting in, not, you know, doing that sort of active management.
Yeah, I
misspoke.
That's what I meant. It's but yeah, the data, the point is that the data gets tracked. If I had to do it myself, that data would not be tracked. It would not be available for my doctor to see it, make a decision that that's not what we have to spend the next appointment going over meds again. No, we can start talking about other issues because the data is there.
Guys, this is amazing. I've been hopeful that some closed door pharmacy around the country would do this, seeing you know, other medication dispensers in the market. You guys are the only ones that I've seen combine the pharmacy services directly with the dispenser. I think it's just an absolutely amazing platform. We have another question in from Tammy. So if any, we are running a little short on time. So if any other attendees have questions, please throw them in the chat. And Tammy's question is, do you provide services to large group home environments, 13 to 14 people, 24-hour care homes?
Yes.
Yes. Short answer is yes. Yeah, we work with a lot of behavioral health and IDD providers and assisted living. So absolutely 24/7, large groups of people. The devices are designed, it's one device per patient. But because we generally suggest mounting them in the patient's bedroom, so they've got a little bit more privacy and some degree of kind of autonomy and comfort around it. Yeah, there's not really a limit on, you know, like the number of people who are living in a space or anything.
So Caitlin's exactly right, but I wanted to add this. For those larger 24-hour care homes, what we can also do, we have other technologies that we deploy to those types of facilities where if you need like stat meds available 24/7, we'll put actually basically a remote pharmacy in some of those places, so that if you know you have a list of frequent flyer medications that need to go, it's different than MedHerent. It's actually a remote dispensing apparatus in that there's actually pharmacy inventory that's not dispensed technically. That's a legal term, sort of regulated by the Board of Pharmacy. But the idea is we'll put a little machine into those larger 24/7 facilities and allow you to call, you know, have your psychiatrist or nurse create access at all hours of the day for certain medications.
And the most common use case for that is substance use providers and detox facilities where they're admitting people around the clock and they need like those comfort meds kind of stuff to help with withdrawal. Is the sort of immediate, like frequent use, but it's a model that can work pretty flexibly in a lot of situations. I've seen them in like crisis programs and that kind of thing as well.
We're going to have you guys on to do another tech huddle on that device as well. This is amazing.
Yeah.
Be aware.
Yeah, we'd love to do that.
From an assistive technology standpoint, you know, when you're trying to get an assistive technology approved for, let's say, for Medicaid to cover it or for waiver services, you have to depend on the truth of self-determination and what does that mean and what does it not mean. Part of what it means is due diligence. And so one of the things you need to do to get anything approved is to show that you've tried other things and that they don't work. And so Maryland has what's called Technology Assistance Program. Every state has one. And they have lots of little pill boxes and reminders and buzzers and things with alarms and things that beep and things that flash if you're deaf and so on. And none of them come close to the class of functionality, support, and independent living that MedHerent offers. So it's important. It's just be aware of that. You need to show that other things don't work. They don't even hold a candle to MedHerent. I don't say those things. That is a thing. It's
Yeah, so I'm assuming you're talking about the Assistive Technology Act programs and their lending libraries, and
that's right.
great
Yeah,
point.
and generally they have medication compliance tools and trinkets, but this is a solution for living. It is comprehensive medication management.
Well, Sama, I really appreciate your insights here. It's great to have somebody that's actually using a device on, and we don't do that enough. So having you has given me some ideas on how we can maybe structure these tech huddles in the future. Thank you. Appreciate your insights. And Caitlin and Yardley, really appreciate you guys jumping on and doing this. Yardley, sorry I missed you at the beginning. I just
No worries.
running thing to thing. Glad we got you in. Any last comments from you guys, or?
No, I mean, we're just really proud of it. We're really excited about it. Dustin, I assume you can share contact information for Yardley and I if anyone wants it or wants to follow up on anything, or you can check out our website.
Yeah, actually, so there's a second patient testimonial video that Caitlin, I'm hoping you'll get to Dustin and he can launch out to the community of people. We, in lieu of showing that video, we had Sama on, but I think the video shows, I mean, Sama is obviously very articulate and very intelligent and very high functioning person. So it's obvious why she's able to interact with the technology. It's also good to see that folks that maybe aren't as brilliant as Sama is are able to interact with the machine. So
No.
Yeah, if you guys can
So
get
I'm going
that
to
to
share
me.
the link. Yeah, I'm going to share the link here, and then Dustin, I'll email you the YouTube links for all of the videos that we have. But if anybody's like super excited right now, you've got it in the chat.
All right. I appreciate you guys jumping on and doing this. Caitlin, Yardley, Sama, thank you very much. Thanks for all of you for joining.